Hi, I'm Dr. Neal Secrist. I'm a board certified family physician. I'm still practicing emergency medicine a little bit on the side while I have a wellness based clinic where we focus on the true and underlying cause of the illness, not just treating symptoms. And I want to share with you things from a unique medical perspective today. Maybe even some advice as if you were in the office and seeing me, and some things that I'm not going to charge you for. There's no copay, but we're going to talk about some things that really make a difference that'll help you be a better Get Fit 21 coach. Things that you can employ in your clients' lives and your challengers' lives, and not just improve your health, but of course them. I'm still doing emergency medicine, and 80% of the visits to the ER these days, I'm convinced, are nutritionally related. Obviously, there's the diabetes, the heart, the strokes, and things like that. But even people being overweight will injure themselves, twist an ankle, bust a knee, something like that. Again, nutrition related, all very preventable. 80% of the success that you're going to enjoy in the Get Fit 21 program and then the all popular transformation program is going to be focused on good quality nutrition. It's not just an exercise deal, but fueling your body properly will be a big deal. And I'm going to refer to some of my notes as we go through here because I don't want to forget anything. In my office, I have a couple of quotes that I share with the patients. Number one is a quote from Hippocrates. He says, "Let food be thy medicine, and let medicine be thy food." Another one is an Egyptian proverb that says, "1/4 of what you eat keeps you alive. The other 3/4 keeps your doctor alive." So nutrition is so key to fueling our body properly. In fact, I'm going to ask you to adopt a mindset as a coach. Adopt a mindset of an athlete. Even though you may not be an athlete, I want you to adopt their mindset. See, people diet and exercise, but athletes fuel their bodies and train. And that's the mindset I want to ask you. If your fuel tank's low and you're hungry, or your gas tank's low, you want to pull into the filling station, you've got some choices there. You've got the high octane 91, you've got the mid grade 89, you've got 87 octane, and then back made there toward the green handle toward the back is diesel. And eventually, I think you'll agree that the engine's going to respond to the kind of fuel that it's fed over time. So what we want to do is fuel our bodies with 91 octane sources. So let me give you a couple of key tips, things that I share in the office that will help you be a better challenger and be a better coach for your people. Number one, honor and teach the powerful 4-4-12 principle. You may have heard this earlier in some of the lessons. Learn what that is. Basically, it's a no snacking principle. See, when we eat frequently or snack, we produce insulin levels that are sustaining high, and then they block any fat burning capability that the body has because it simply can't burn fat in the presence of high insulin. And snacking does this. So when you eat, wait a minimum of 4 but no longer than 6 hours before your next meal, and then eat again, and then wait 4 to 6 hours for your second meal, and then eat again, and then wait 12 hours for your third meal, you invoke the 4-4-12 principle, keeping your insulin levels low and allowing you to burn fat. So the benefits of that are faster inch reduction, better blood sugar control, and a reduction of your cravings. Number 2 tip, understand the perils of dairy. Now, we're raised in a society where we're taught that it's important to drink milk and eat cheese and things like that because of calcium to build strong bones. Well, the sad reality is we have one of the highest rates of osteoporosis in the world, and yet we're some of the biggest dairy drinkers. And, where does a cow get its calcium anyhow, right? It gets it from the grass. And where does it get its protein? Also from the grass. So simply, we have so many allergies to the cow protein out there these days. In adults, it's manifested in the form of weight gain, blood pressure, cholesterol, diabetes, and osteoporosis. In kids, it's manifested in a little bit different form. It's asthma, allergies, eczema, dry skin, constipation, and bedwetting. They're all simply allergies to the cow protein. This has nothing to do with lactose intolerance. So understanding that we're over dairied is a key concept. And I'd encourage you to go to a YouTube search under perils of dairy, and look at the third or fourth hit down there. It says 10 reasons to ditch dairy. I'd encourage you to watch that little 10-minute clip and see if that doesn't really impact you and help you start modifying some of the fuel you're giving your body. Number 3 and final tip is you want to teach people how to fuel their body with high quality protein. 91 octane sources of protein, like 99% lean ground turkey, chicken breast, whole salmon, tuna, shrimp, egg whites. They're some of my favorites, but there's a lot of vegetarian options too if you prefer plant-based options, all very good without dragging along with it a lot of extra fat. I mean, the fat I eat is the fat I wear. So having a lower fat, lower carb, but primarily seeking protein as fuel is going to allow you to achieve your results. And so my final call to action to you would be adopt and teach an athlete's mindset of fueling your body and train and emphasizing the powerful 4-4-12 principle. And number 2, let's put the cow out to pasture and replace it with high grade, high octane sources of protein. I hope you found these helpful, and I look forward to talking with you again in the future.